Welcome to the Pharmacists Are In, a podcast made for pharmacists by pharmacists. Pull up a seat and let's get started.
Back to the live stream. I'm your host, Ajit Johal, with the Pharmacists Are In podcast. And I'm still not joined by Dr. John Papastergiou. Where is John? That's the question of the morning. Hopefully he'll show up. So we had a great interview with Tina and Bonnie earlier this morning. And now we have Manjit and Kristen here today. And I'm excited to dive into a conversation with both of them. But first of all, why don't we just introduce yourself and just give a brief background, where you're from, and what does Pharmacy U mean to you? Starting with you, Manjit.
Yeah, great. I'll start. So I'm a pharmacist. I graduated back in 2003. I was an associate with Shoppers Drug Mart for about 20 years. I decided to leave October 2022 to start RX Renewal. So that's a company that's really focused on preventing and managing burnout for healthcare practitioners. And what Pharmacy U means to me is just this one of the best conferences I find for networking, seeing old people, listening to great talks, and just reinvigorating what's happening in pharmacy and really connecting with other people and seeing what they're doing because it might be a year since I've talked to them again. So it's a great way also to be aware of new treatments and new products that are becoming available for pharmacists to help treat their patients.
Absolutely. And I liked your conversation about the networking piece because Pharmacy Vancouver. So I'm from Vancouver, but it's just everyone who's anybody in pharmacy is there and they can have it. And then when you say seeing old people, I assume you're seeing old friends. But in terms of old people, my dad also goes to Pharmacy U Vancouver. So I thought I'd say that. But thank you for that, Manjit. Excited to hear more about what you're working on. Kristen, a bit about yourself and what does Pharmacy U mean to you?
Sure, thank you. Yes, my name's Kristen. I am the representative for CardioSmile, the product that we'll be speaking to today. It is a plant sterol. Like Manjit said, CardioSmile has been available only in Ontario for about a year. And so there's 3 of us in Ontario that are bringing awareness to this unique product. It's the only product in the world that lowers cholesterol the way that it does in a unique formula, and it's a natural product. And so what Pharmacy U means to me and us as a company is, like Manjit said, bringing awareness to this new molecule and familiarizing ourselves with some new faces. And really we would like the pharmacists across Ontario to become aware of our product and be able to confidently talk about our product as well when patients come in and ask for it, because we are gaining much traction in just this year. So this is a great platform for us to meet some new faces and also to introduce Mantra and CardioSmile.
That's fantastic. And I know, Manjit, we were talking about it before the podcast started. You're presenting on this today at 11:30.
Yeah, that's correct. Just in about half an hour. So it's a perfect timing.
Yes. So we can do a bit of a warm up. So let's preview the session a bit, as Kirsten was saying. I have an interest in this. I'm a clinical pharmacist from BC. I work a lot in the immunization space, but I also do chronic disease management. And we have access to labs. So obviously I can see when cholesterol is creeping up, and statins are the tried, tested, and true tool. But there's even people, including my own mother, that is kind of hesitant, borderline, doesn't want to take a statin just yet. So yeah, love to know. Don't give away too much, because if you want to see the full information, you got to attend Manjit's session. But maybe just a quick elevator summary on what your key points you're going to hit on in this presentation coming up in less than 45 minutes.
Yeah, so just from a stats perspective, 50% of patients that are using a statin are not a target. And about 25% refuse to take statins as well. So there's a huge ability for us to be able to do something with this. And to your point, with point-of-care testing, we have real-time access now to lipid panels that patients are getting done in our pharmacies. And how many times do we say, okay, this is where you're at, this is where you should be, and go and see your doctor, or I'm going to write a recommendation to get a new script for something. How many times do we miss that ability to do something? And this product, CardioSmile, is bringing this autonomy and the self-agency to pharmacists to be able to make an intervention at that point. So the patient leaves with something in their hand that's going to decrease their LDL by an average of 12%, decrease their triglycerides by 14%, increase their HDL-C, and also decrease their ApoB by 7%. And then non-HDL also decrease in 11%. So we're decreasing like almost every lipid target by almost double-digit perspectives with little to no side effects, because the way the plant sterols work is only 1 to 5% of them are actually being absorbed into the blood. Because of these, they're called ABCG5 and ABCG8 pumps that pump it back out into the lumen. So yeah, I think it's a really, the reason why it's so effective is because we as pharmacists are so accessible, and we're seeing these patients all the time, and this is actually a practical intervention that we can make at the pharmacy.
Definitely, though, and I think when you're talking about the ABC pumps, that's probably going to look a lot better in your slides, right? Just seeing the, I can already visualize it.
I need the slide to remember what it was, so now I didn't have the slide in front of me, so I was going by.
No, you did good.
Okay.
Yeah, that's impressive.
Just have to see if it's actually right, though.
Yeah, no, but I'm sure visually it'll look great. So I know there's a lot of people live streaming this or walking around, so do attend that session. It's very, very exciting. So Kristen, what have the conversations been like with pharmacists when you introduce this idea? Because you saw, like, my eyes kind of lit up, because I can even, from my own personal experience, let alone patient experience, there is a challenge. I have patients who don't want to take statins because of side effects, don't want to take a prescription medication, because often there's a lot of patients, the statin's the first drug they're ever prescribed, right? Mm-hmm. So it's like, oh no, right? I don't take any. They had this sort of like swagger. I don't take any medication.
The aura, yes.
Yeah, aura, swagger, aura. You use the word swagger in your presentation. I don't take any medications. Now they're taking the statin. And it's like, wait a minute, isn't this for patients who've had a heart attack? And I even have patients all the way on the other end who are quite high risk, for, post-MI that can't tolerate the statins. So one of my family members is a competitive soccer player, plays in a men's league, and just had these terrible calf cramps. So he was referred to cardiology, and they just kind of lowered the dose of the statin as much as they could, added some Ezetrol. So it's almost like a specialty clinic was playing with this. So now that there's another option, I'm very intrigued. So I'm wondering what the response of pharmacists are when you talk to them.
Yeah, that's a great question. I've been in and out of pharmaceuticals for about 20 years, and I would say that CardioSmile, when we talk to pharmacists about it, it is definitely the most, it's the easiest product to talk about, and they are the most excited to hear about it because it is unique. And because of the clinical data that it does have, and we all know pharmacists love to talk about their data.
Yes. We got to talk about data. We have to.
They love it. And so, like I said, it's great that they now have an option to offer their patients, and being incorporated into the Canadian Cardiovascular Society guidelines.
Oh, that's big.
First line therapy for in terms of lifestyle behavior modifications. Pharmacists love to hear that, and it really is. I don't like to use the word sell, but it is an easier sell from that perspective for the patient, because they know that it's been tried and true and very well tested, and the pharmacist feels comfortable once they're aware of that as well. Or maybe they've already known that plant sterols are in the guidelines, but then when we give them that gentle reminder and tell them about CardioSmile, they're very excited about it and incorporating it, especially into those patients who borderline, like you said, who they're hesitant to start a statin. CardioSmile is an excellent solution for them. And even those patients, like you said, your relative who is higher risk and they've been lowered the dose of the statin, added Ezetrol, and CardioSmile can be added on top of that just for that extra protection. So they love it. And so we're really hoping that after this podcast, that there's more familiarity about it when patients come to ask them about it.
Absolutely. Well, there'll definitely be a lot of familiarity. There's a lot of subscribers to the podcast. We'll be posting this episode. And if you don't mind, I'd love to link the cardiovascular guidelines. I'm sort of the data person.
Perfect.
I will make sure our producer puts that in the show notes.
Perfect.
So that people can click that and see. Because now that you mentioned it's in the guidelines, it changes the game, right?
Absolutely.
The name
makes my job easy. Yes. It really, really makes my job easier. As soon as you say that, people's ears perk up.
Do you ever speak to cardiologists about
Absolutely, all the time. So our mission, although this is an NPN product, our mission once we set on the road in January was to start really at the specialist level and work our way down, because what we didn't want was for people to purchase it behind the counter at the pharmacy, and then if and when they ever got to the cardiologist, endocrinologist level, we didn't want their specialist to say, what is this? I've never heard of it, and take them off of it. So we have started at the specialist level, and let me tell you again, I've been selling or speaking to pharmaceuticals for a long time. This is the first time I've ever done an NPN, so a natural product, and they love it. I was very hesitant to start selling an NPN product, but they love it, they welcome it, and they're excited to offer it to their patients, especially cardiologists.
That's fantastic. Can patients take this and the statin at the same time?
Absolutely, yeah. There's actually a study that showed that it's an additive effect.
Oh, wow.
So whatever they're getting from their statin, they can take this in conjunction. No myalgia, no muscle cramping, no increase in LFTs. So from a safety perspective, extremely safe. And it's going to be equivalent to almost a quadrupling of a statin dose, right? Because every doubling of a statin dose, you get an extra 6% decrease in LDL. So this has an average of 12%. So it's almost the equivalent of quadrupling your statin dose. So from that perspective, it's also great. And just one thing I wanted to touch upon that Kristen mentioned is, I think it's great in terms of that communication, the way that it's been kind of circulated to talk to the specialist first, because then sometimes we're, as pharmacists, we're seeing this on a script, and now we can kind of close the loop where we're providing the product because we have it ordered in our pharmacy. We can provide it to them, we can just top up the counseling. And then there's other times where we're, being the originators of that recommendation, but then when the cardiologist sees that, then they're also, great, I also did, I also understand a little bit about what this is about, so that's great that the pharmacist took that initiative, because it's something that never really occurred to me. So closing the loop on both sides, I think, is super important, because as consultant pharmacists and as clinical pharmacists, how often sometimes you make a recommendation that's not met with, even though you have the guidelines, you have the evidence, and then the doctor, for some reason, because they haven't been detailed on it, they're not aware of it, and then they kind of prevent the patient from going on it. So, that's something that I think is really, really interesting in terms of the way that it's been communicated to healthcare practitioners outside of pharmacy.
No, that's fantastic. And then we also have a subset of patients, typically, as I was mentioning, is the dyslipidemia tends to creep up early, and that's often the first medication they start. So early starters would benefit from this as well, right?
Absolutely, and I think the other thing that we're finding, especially in the emerging guidelines, is that it's not only just the number. It's almost similar to how we look at diabetes, right? Diabetes, we always used to look at that glucometer prick and what's the glucose number right now, and that has shifted over to the CGMs to looking at what's the trend and how much time are we having this dyslipidemia or this hyperglycemia. And similarly, if we treat it early, we're going to have lower LDLs for a longer period of time, which decreases endothelial damage, decreases oxidation, decreases plaque formation, and all that stuff that increases the risk of major CV events.
Totally. We do what we can to prevent major adverse cardiovascular events. What is the price of the product?
Do you want to speak to?
Sure. I'll speak.
Just a ballpark.
Yeah. So on average, you can expect to see it at pharmacies. Generally between $39.99 to $41.99 is the price point of it, and that is for 30 sachets of CardioSmile. So that's a commercial box of 30 sachets. They are a liquid sachet that you take once a day, and so that's roughly about $1.33 per dose. So very reasonable for the benefits you receive from CardioSmile.
Great, and it's actually, I didn't ask this, but you kind of answered it. You mix it and drink it.
Yes, you can mix it in food or liquid or solids. It doesn't matter.
Yeah.
Food or drink, hot or cold, or you can take it alone. It is a consistency, I would like to say, of an oat milk, although it is completely made of plants, so it's lactose free, gluten free, vegan. So you can take it alone. You can mix it. A lot of people mix it with their oatmeal or put it in their smoothie, their protein drink. It is tasteless, so you can take it however you want it.
Well, I like the oatmeal because that's heart healthy, and then morning smoothie, right?
Perfect.
Yeah, there you go. That's awesome. Question for you, Kirsten. CardioSmile. Do you know how the name came about?
I don't know the specifics, but I do know we had adopted it. We inherited it from, I believe, over in Europe. I believe that they started with that and they had such success, so I don't think they changed it. So we do get a lot of questions, where did that come from? A lot of people assume it's a dental product. It is not. It means heart healthy. So yes, it's CardioSmile, all one word, if pharmacies or pharmacists are looking it up in their system, because sometimes if you do enter it 2 words, it won't come up, but CardioSmile, all one word.
Oh, nice. Okay, that sounds good. And I guess the patients are smiling about their cardiovascular health, right? The smiling at the thought of not having to go to 80 milligrams of atorvastatin. No, that's fantastic. And which you're saying in Europe? Is it around anywhere else in the world, or?
So yes, it originated. So CardioSmile has been in research and development for over 13 years. So it did originate in South America. It is now available in Europe and the United States, and now finally we are able to produce it here in Canada and specifically Ontario just January last year.
Nice.
It's been in Quebec for
almost 3 years
3
in
years
Quebec.
now.
Yeah.
Okay, and then what about the Western provinces like BC?
Absolutely, it's available. Yes.
Okay.
So when we speak Ontario, we mean rest of Canada, meaning rest of everything.
Sorry, Ajit. Sorry.
Well, I was just going to say
Toronto's the center of the
the
world.
universe. I think we just
right.
saw that case in point. So yes. Okay, so-
Apologies to Western Canada.
That's okay. We're at Pharmacy U Toronto right now, so that's totally fine. No, that's fantastic. Well, I mean, I have a smile on my face about CardioSmile. Patient testimonials. Is there any sort of anecdotes that you've heard from pharmacists saying this patient refused to go on a statin? Any sort of success stories anecdotally that you've heard?
For sure. You can always go to the CardioSmile website, cardiosmile.ca, and there are a lot of testimonials posted from specialists, from patients, from registered dietitians, from pharmacists. They speak highly of the product and the success. What a lot of specialists and healthcare providers are very surprised about is the extent of the triglyceride lowering as well, and that ApoB component as well, because other plant sterols have never been tested to show that, and that ApoB lowering effect of CardioSmile is something that a lot of the testimonials speak to.
That's fantastic. Yeah, I mean, just from my experience with working with metabolic disease, patients with metabolic disease, triglycerides are tricky, very tricky. And then, of course, ApoB is emerging as a very key indicator for a number of, obviously, major adverse cardiovascular events. No, that's fantastic. I mean, I have a smile talking about CardioSmile. I'm going to integrate this.
You can't see it, but he's not lying.
Yeah. I do, yeah. So that's fantastic. Thank you for that. Just want to finish off, Manjit. I'd love to know a bit more about your Renewal RX, regeneration, burnout, because, as pharmacists, we're taking more and more on. There's more expanded scope. There's obviously not a lot of collaboration with the government in a lot of places. The model is shifting from dispensing to clinical services, but that's, of course, comes, you need to balance revenue and owners and staff pharmacists. So tell us a bit about the work you're doing, because I think it's so important.
Yeah, it's really just about increasing awareness about what you're going through on your own self. So mindfulness is a component to that, but also understanding the energy that you're bringing to the workplace and how that's rubbing off on other team members. As the pharmacy owner, the pharmacy manager, even the pharmacist. I mean, everyone is looking to you. And the way that you are able to regulate yourself in periods of high stress, the way that you respond to different situations is extremely important. So that work is really just involved with helping through breath work specifically, but also through mindset shifts and perspective shifts and focus on sleep and these other types of modalities about how you can bring the best version of yourself to work. But that also will translate into your personal and professional lives as well, right? So I think it's something that everyone needs. I mean, with the burnout rate in pharmacy, you know how high that is. It's like 8 out of 10 pharmacists are suffering from burnout. So there's definitely an opportunity to be more mindful of that and to be the leader in terms of how you're carrying yourself. And once you control yourself, then other things will fall into place as well. As cliche as that sounds, there's a lot of truth to it.
No, it is. And it has like an amplifying effect, because if someone's, taking care of themselves, they can actually be the best for their patients too. So there's many people that can benefit from that person who's now, renewed, per se.
Absolutely.
No, that's fantastic. Well, thank you so much, Manjit and Kristen. Any final comments about the conference or anything?
Go ahead, Chris.
I was just going to say thanks for having us, and special thanks to Manjit for presenting for us today. I'm looking forward to hearing his talk, and we're really thankful for Pharmacy U for having us.
Yeah, thanks to Marty and the team at Pharmacy U. They've always done a great job, and I just seen how this event just continues to grow and grow. So really excited to be speaking at it and then seeing old friends and connecting with everyone. Thanks so much for the invitation, Ajit.
No, of course. I enjoyed having you both on. Manjit, best of luck in your presentation in 30 minutes. You'll do great. Hopefully this was a good warm-up, and you'll kill it with those ABC pumps. Yeah. And thank you, Kristen, for sharing your experience with CardioSmile. Thank you both. Enjoy the rest of the conference.
Thanks.
Thanks.